to be doing your cardiovascular assessment today.
Okay.
I'm going to first start by taking your vitals. I know we've already gotten your temperature, and it was 98.7, and your respiration rate was 16. So I'm just going to do your blood pressure. Okay?
Okay.
Is using your right arm fine?
Yes.
Okay. I actually do a two-step blood pressure, so it's just going to take me a little bit longer than normal. Okay, could you go ahead and put your hand upside down? Perfect.
What was it?
The top number was just 110, so that means I'm just going to pump it up the second time to about between like 120, 130. It's just to make it more comfortable for you.
Okay.
Okay? Alright, Christina, so next I'm just going to inspect you first, okay, to see if I see anything, alright?
Okay.
So I'm just going to be looking at this. Sorry, my hands are a little close. I'm just going to be looking at the temperature of your skin, noticing any edema. Alright, that edema is swelling, sorry, just so you know. Alright, can I see your fingers real quick? I'm just going to check your capillary refill. Thank you. Alright, less than 3 seconds. Just going to Alright, Christina, so next I'm going to be checking for jugular venous distension, and that's just to make sure that your heart is pumping your blood efficiently, okay? Alright, so I'm just going to observe you right here. Alright, and so since this bed doesn't move down, I'm just going to help you lean back because I do need to lean you at a 35 to 40 degree angle, so I'll have my hand behind your back, okay? So go ahead and lean back. Alright, and then sit up. And then if you can just lay down all the way. So while you're like this, I'm also just going to be checking for any pulsation, so if you could just stay still for me, okay? I'm also just going to check your carotid pulses, okay? To palpate your chest wall. I'm going to be feeling for any thrills or heaves, and that's basically just like turbulent blood flow that I would feel with my hand, okay?
Okay.
Alright, so at one point I will have to have you lift up your shirt a little so I can get better access, okay? Going to start at your angle of Louis, go to your second intercostal space, do right sternal border, listening to your aortic valve, going to the opposite side, listen to the pulmonic valve, to go down to the fifth intercostal space, left sternal border, excuse me, and I'm feeling for the tricuspid valve, okay? So I'm going to have to pull this down just a little. Alright, and if you could lift up your shirt a little bit for me, please. Alright, and now I'm to go to your fifth intercostal space again and go to your mid-clavicular line, so right in the middle of your clavicle, and I'm going to be feeling for your mitral valve, okay? Chest does look symmetrical, okay? Alright, Christina, so next I'm going to auscultate your heart, so I'm going to be listening to your heart, okay? It takes a little bit longer because I do have to listen to each portion of your heart twice, one side with the diaphragm of my stethoscope to listen for the high-pitched sounds, and another side with the bell of my stethoscope in order to listen for low-pitched sounds, something as like a murmur or something, okay?
Okay.
So first I'm going to listen to your pulmonic valve, so once again I'm going to start at your angle of Louis, go to your second intercostal space, and then I am going to be on your right sternal border for your pulmonic, okay? And it does have to be for 30 seconds each, so it's going to seem like it's a little bit long. opposite side, the second intercostal space, the left sternal border. Next, I'm going to listen to your tricuspid valve, so fifth intercostal space, left sternal border. So I will need you to just pull it down just a tiny bit for me. Thank you. All right, perfect. I'm going to do the same thing, but I'm going to be listening to your mitral valve, so I will need you to lift up your shirt a little and try to move your breast tissue a little bit out of the way for me, because it usually is like right underneath, okay?
Okay. My left breast?
Yes.
Okay.
Pull it over to the side a little bit for
Okay.
me, okay? Perfect. Thank you. Here, I'm also just going to take your apical pulse, so I do have to do that for a full minute, okay?
Okay.
All right. Okay. And put your shirt back down. All right, Christina, so I'm actually done auscultating, and I heard your S1s at your mitral and tricuspid valve, and I heard your S2s at your pulmonic and aortic valves.
Is that normal?
Normal is not in my vocabulary. But I did not hear any adventitious sounds like an S3 or an S4, so your heart is functioning as it should.
Oh, great.
Lifeway process, I'm going to listen to your aortic first. Alright, and next I'm going to be going diagonal to listen to one of the renal. Alright, and then I'm going to go to the opposite side to listen to your other renal artery. To your iliac arteries, which I need to start at your umbilicus or your belly button, and I'm going to go diagonal from there, okay? Alright, and then the opposite side. Okay. Alright, so Christina, before I begin to check your pulses, at the same time, I am going to feel for your lymph nodes to see if there's any swelling or anything. So I'm just going to put on gloves, because when I go into your armpit, I'm going to use gloves, okay? I hope you're not too ticklish, because I am going to And ideally, I shouldn't be able to feel them, but if I do feel them, they should be mobile and not firm.
Okay.
Okay? Alright, so go ahead and kind of lift up your arm for me a little. Here. And then your... Alright. I can do your other side for me, please, too.
Lift up this arm for the...
You can. I'll just to make sure I didn't miss anything. Take these off. Alright, and so I'm just gonna, I have to do your pulses at your lower half too, so I'm just gonna start with your pulses on top. So I already did that carotid pulse first, and next I'm going to be doing your brachial. So I do need to do both at the same time, so I'm going to find one and then try to find the other on the opposite side, okay? Next, I'm going to be doing your radial pulses. Alright, so next I'm going to be listening and palpating, feeling for your femoral pulses, okay? So So I'm going to start at your iliac crest, and I'm going to go inwards. And I hope you're not too ticklish, because I do need to feel down for it.
I'm a little ticklish.
Hopefully you'll find it. You'll be okay. And then I will need you to kind of lift up your shorts a little, because in order for me to listen to your femoral artery, I do need to be skin to skin. Okay, so just go ahead and lift. You can do one side at a time if you want, okay? Let me just make sure I can find it again. Okay, great. I'm gonna move this side now. Do the same thing on this side. Also, while I'm in this area, I am going to try to feel for those lymph nodes, so try not to. Alright, great. Right, next I'm going to feel for your popliteal lymph nodes as well as your popliteal pulses. Okay, so if you can go ahead and bend your knees for me. Perfect. I'm just going to feel for your nodes first. Okay, let's see if I can find. These are kind of hard to find, so bear with me while I kind of try to. You can go ahead and put your legs back down. Next, I'm going to feel your dorsal pedal pulses. So the last pulse I'm going to feel for are your posterior tibial pulses. Christina, now that we're done with your pulses, they are bilateral, symmetrical, and a 2+.
What does that mean?
They're not weak and they're not bounding. They're brisk, which is ideal.
Oh.
Alright, so I'm almost done with my assessment. I do have a couple special maneuvers I need to do first, but before I do that, I just want to check the capillary refill on your toes, okay? Less than 3 seconds. So I'm just going to keep having you lay down, and I'm going to perform a Homan's test. Sometimes this is used to help detect DVTs or deep vein thrombosis. Alright, so go ahead, hold your knee up to your chest. Perfect. And I'm going to push and flex your foot. Do you feel any pain?
Nope.
No? Okay. To your other side. Same thing. And bend your knee to your chest. Flex your foot. Any pain? Nope. What you have to do is an Allen's test, which is for your hands or your upper extremities, and it's just to check for arterial insufficiency, okay? Alright, so I'm going to do one hand at a time, so go ahead and give me your right hand. Perfect. So I'm going to occlude your ulnar and radial arteries, and then I'm going to have you pump your hand at least 5 times until it becomes white, okay? Alright, so go ahead and start pumping. Alright, that's good. Okay. And then we're going to go ahead and do it again. To your other hand. Go ahead. That's good. Okay. Sorry, I'm really pushing really hard. Okay. Alright, go ahead and do it again. Alright, good. Alright, has anybody ever mentioned Raynaud's to you before?
Yeah, I've known about that for you.
Alright, Christina, that concludes my cardiovascular and peripheral assessment. Do you have any questions for me?
I don't.
You don't? Okay, great. So prevention is the best method, so keep up that exercise routine you have and your healthy diet, okay?
I